might have been able to say we had an open wound of the abdomen, we have many, many more choices now in ICD-10. And maybe you've heard, I'm sure you have if you've been reading, about this seventh character extender. All injuries, this huge increase in the Chapter 19 of the S and the T codes, all injuries are going to require a seventh character extender. And there are three that we're going to use most typically. A is for the initial encounter, S is for the subsequent encounter, and D is for the subsequent encounter, and S is for the long-term after effect, for a sequela. Any of you who've read some of the mainstream press articles about ICD-10, they always make these jokes about how, you walked into a lamppost subsequent encounter and make it sound like you walked into the lamppost twice. You were so foolish, instead of just walking into the lamppost once, you did it a second time. But what it really means is that the provider saw the patient for the initial time, and many different providers can see the patient for that initial time, the ED doctor, the trauma doctor, whatever. And then when you follow up with that patient, you use the same diagnosis code for the injury, the contusion, and you use a different seventh character extender to say this was a subsequent encounter for a treatment. I'm going to feel a little sorry for our orthopedists and our trauma surgeons, because those are going to be hard. And fracture coding is even more complicated. So while most injuries are going to require just the A, the D, and the S, in fracture coding, there are many, many more options. For certain kinds of major trauma for major fractures, we're going to be using the Castillo classification as the seventh character extender to tell